Right. So I think it's a personal type thing, right? Some people appreciate it, some don't. I'll give you an example of a patient we've seen. She needed therapy, but she didn't want to go into the clinic, the practice, because she didn't want the receptionist to know her problem. And again, Namibia is so small, so everybody kind of knows everybody. So she felt comfortable using technology because it was directly with the doctor and it was private, like in a sense of she didn't need to reveal her issue to everybody in this if it were to be in person. And then you have those that say no, I prefer seeing a doctor and I prefer being touched by a doctor and so on. So again, it really depends on people, right? We've seen employers appreciate our technology because it reduces absenteeism at work, as an example. Before technology, when the employees needed to go, when the employees were sick and they needed to go, when they needed to be seen by a doctor or they needed to book themselves in the clinic, they would be 3, 4 days out of work just because of that, right? So because of technology, the absenteeism is reduced simply because now it's much quicker to access these professionals.
Yeah.
I think AI is a bit scary, to be honest. Having robots cut you open and stitch you and all that, no emotions, no human touch. But at the same time, it could be more accurate as well. There could be better results too, right? So I'm really on the fence with that. Still, I'm not too comfortable with that, and that's why we are only using AI for our symptom check and our KYC compliance and a few other areas, not really replacing nobody. But yeah, we've seen people appreciate it, and we've seen people say no, never use this, and that's okay. We work with those that appreciate it, right?
Mhm.
Yeah. So that's yeah,
I
that's
think it's a consumer behavior. Yeah.
yes, you're right.
I think it's a consumer behavior shift that would have to happen, it's take a while, but it's definitely going to happen at some point where everybody gets comfortable using technology for health. But I mean, great success story there in terms of like how you've been able to support patients get care. I mean, just using my own example, I have a family member who had to like go to the hospital, like you said, because she had like a follow up to go and see the doctor to show the test results. Like she went to the hospital, the the doctor was not available because of long queue, and don't like she even actually got there late. She got there very early, like 6 a.m., but there were a lot of people, backlog of patients who wanted to see a doctor, right, just to just consult. And one, not just once, twice, 3 times. I was like, what's happening? Like, it takes 3 months to show your test results to your doctor to actually get a prescription or a drug to use, and that's actually not really cool, right, in this age
No,
and time. So what you're doing with patient care, I must say, is very commendable, because you know we need to move past that. Just to see a doctor to show my test results shouldn't take me 3 months. What if it was a critical condition that I needed care for? Like, how would I have manage that condition? So definitely technology must somehow come in to fill that gap that we are seeing in terms of like patient accessing care. Yeah.
yeah,
Thank you. So yeah,